White House, out of 327 million Americans, coronavirus may eliminate approximately 200,000. In one of Donald Trump's most current interview, it was suggested that approximately 200,000 American residents would pass away from the new coronavirus. The briefing consisted of forecasts in between 100,000 and 200,000 as a possible best-case situation, and suggested that they are working hard and that they can wind up with a number below 100,000 if everything works out. You may be thinking that a person 100,000 and 200,000 deaths out of 327 million Americans is nothing. In a sense, compared to other infections and illnesses that are distributing out there, you're right. The difference with the coronavirus, nevertheless, is that the deaths are collecting in such a brief period. That being said, the world, as well as America, has been through major pandemics before, with the last one receiving significant media attention being the swine flu. This particular stress of the flu infection infected 1.4 billion individuals worldwide, and in 1 year, took around 60,000 American lives. The flu alone is accountable for approximately 70,000 deaths every single year in America alone. In truth, a big part of this with a flu virus, prior to the new coronavirus, already have some sort of coronavirus infection within them. Some doctors and researchers around the globe are raising red flags and calling into question the procedures that are being taken as a result of the new coronavirus, claiming that there is unnecessary panic and hysteria going on. For example, Dr. Martin Dubrovic, an allergist immunologist, wrote a post for the Association of American Physicians and Surgeons released on March 29. In it he states the following to offer individuals with viewpoint. Of all the deaths reported in the United States since today, just 2 have remained in clients under 18 years of age. Currently, our death rate, deaths, confirmed cases, has been as high as 2.3% and as low as 1.1% over the previous 2 weeks. The President's COVID-19 task force estimated that as numerous as 1,000th New Yorkers might have the infection. If this were predicted to the entire United States population 328,239,523, then the total number of COVID-19 would be around 328,239, and deaths from COVID-19 1.8% death rate at 5,909. Even if this ends up being incorrect by 1,000%, the death rate would still be 59,000, i.e., within the range of the price quotes for influenza deaths. You can take a look at it in another method. 98% of individuals who get COVID-19 fully recover. Since today, March 29, 2020, there are 123,828 validated cases and 2,229 deaths, 1.8% death rate from COVID-19 in the United States. Compare that with the influenza estimates so far this year, 29,000 deaths. And the influenza season is not yet over, with the CDC estimating as lots of as 59,000 will pass away from influenza by May of this year. The CDC estimates a death rate of 7.4% for influenza-like health problems and pneumonia this year. This death rate is similar to previous years. Who in the media is discussing this? Coronaviruses have been in presence for several years. They infect tens of millions of people every single year worldwide and likewise add to their deaths. It appears that the novel coronavirus will be no different, but I do not have a crystal ball. Paper recently published in the International Journal of Antimicrobial Agents titled SARS-CoV-2, Worry vs. Information claims that the problem of SARS-CoV-2 is most likely being overestimated. Inconsistent reporting? In the current White House briefing where the President provided the White House's quotes, Dr. Deborah Leah Birx, an American doctor and diplomat who specializes in HIV, AIDS immunology, vaccine research, and international health, who is presently acting as the coronavirus response coordinator for the White House Coronavirus Task Force, stated that there is not a lack of ventilators in New York City, as declared by multiple mainstream media outlets, like CNN. This is likewise complicated. To see these remarks in a White House press conference directly oppose what mainstream media outlets are reporting. Not to state hospitals are not overwhelmed today. Still, mainstream media also using healthcare facility footage from Italy and declaring it's from New York more added to the suspect people have of traditional media. Dr. Sucharit Bhakti, a professional in microbiology and among the most pointed out research scientists in German history, recently shared his thoughts on the measures that are being taken to fight the new coronavirus. Bhakti developed a YouTube channel on March 18 and has considering that posted 4 videos that have gotten more than 1 million views overall in a very brief period. Based upon his thinking, the existing measures being put in by international, federal governments are unneeded and exorbitant. You can view his last video, which was in the kind of a letter written to the German Chancellor, here. If you can't comprehend German, make sure to switch on the English subtitles. Application of the current severe measures that are so incredibly limit essential rights can just be justified if there is reason to fear that a genuinely, exceptionally hazardous virus is threatening us. Do any scientifically sound data exist to support this contention for COVID-19? I assert that the answer is no. Dr. Wolfgang Waderm, a well-known pulmonologist, sharing his thoughts on the brand new coronavirus. In it, he questions the present lockdown measures being taken by governments worldwide. You can view that video and find out more about it here. Once again, if you can't comprehend German, make sure to turn on the English subtitles. These beliefs likewise echo those of 3 Stanford professors of medication who recently shared their professional opinion that extraordinary claims require amazing data. You can check out more about that particularly here. Will Donald Trump and his staff be appropriate? Will the death toll in the United States be no higher than 200,000? We have yet to see. It ought to be kept in mind that designs are always extremely unreliable, and new data is continuously being available that are altering the projections. For the many parts, it seems that the procedures we are taken and have may not be necessitated. However, is it better to be safe than sorry, or is something else going on here? Just only recommending that something else might be happening will have fact checkers all over one's platform, censoring it and also flagging it as false news. According to Dr. Ron Paul, individuals should ask themselves whether the real threat of the illness enormously overemphasized by those who look for to benefit financially or politically from the ensuing panic. Fact checkers flagged him for merely sharing his viewpoint. Beyond fear. However, we have provided lots of tools to not just move beyond fear, but to increase your immune system with food, breathwork, and quality supplements. We have also put out some of our latest content to assist people to move conversations away from a far narrative and into one where we can question our reality and how we can efficiently alter it. See the links listed below for information. You might be believing that 100,000 and 200,000 deaths out of 327 million Americans is nothing, and in a sense, compared to other infections and diseases that are flowing out there, yeah. The distinction with the coronavirus, nevertheless, is that the deaths are building up in such a short period. If this were predicted to the entire United States population 328,239,523, then the overall number of COVID-19 would be around 328,239, and deaths from COVID-19 1.8% death rate at 5,909. Even if this ends up being wrong by 1,000%, the death rate would still be 59,000, i.e., within a variety of the price quotes for influenza deaths. As of today, March 29, 2020, there are 123,828 confirmed cases and 2,229 deaths, 1.8% death rate from COVID-19 in the United States.